And there was a gentleman who was led out of captivity and described how he developed a severe pneumonia. He became septic. He really was tanking, basically. He was not buff, as you guys would say. Thank you for using that word. I had to slip it in somewhere. This gentleman was tanking. He was septic. He had pneumonia. He was short of breath, and he was encephalopathic. He could barely come to consciousness. But he said he recalled vividly that when he came to, there was Terry Anderson sitting there, available, attending to him, and connecting to him in a way that was palpable to him. He came out and spoke about his captivity, but one story that stuck with me, and seemed to be the one that he was recounting over and over, was the fact that he attributed his survival to the very fact that this man was available and present, and nothing else was being done for him. He just had another human to connect with. Another issue for you guys to think about is what is your goal in helping patients? Is it living forever? Is it living without pain? There really is a kind of a spiritual emptiness right now. And sort of stay with this theme of connectedness, I really think that is one of the big solutions for you guys. I, of course, as an internist, have opportunity to come in contact with young people whose lives are being cut short by illnesses such as HIV and whatnot. And I will tell you that without exception, people whose lives are being cut short and for whom life for a brief period does not make sense. Why is this happening to me? What was life about? Why was I born? To a person, as they struggle with these issues and come to the other side, a resolution of this feeling, they recognize that their purpose and their meaning and where they derive the most from life is their significant relationships, their intimate connections, the people they love. And that is what they derive meaning from. So what are the roles you guys might contemplate in terms of providing these kinds of role models, giving these sorts of messages to not just individual patients, but again, the community at large? First of all, I would tell you that media is a tremendous squandered opportunity. We as physicians have very often, again, gone for the health reporting, but been very reluctant to involve ourselves in other aspects. And I would encourage you to dig into media wherever possible. It is a squandered resource. Realize that I have a philosophy we call the Gainsberger pill philosophy, which is if you want to give an animal a pill, you have to wrap it in Gainsberger or turkey. You can't give it the pill and expect it to take it. And in media, that philosophy really does prevail. You must not fear the Gainsberger. God knows I've had to tolerate a lot of it. I think focus on young people. Stay focused on youth. I really think it's one of the regions I really appreciate the opportunity to come and speak to you guys. I'm touched by it because it really is what inspires me to see the young people coming up. I will tell you that I was asked to give a talk to first and second year medical students about 10 years ago at a time in which I decided I wasn't going to be involved in media anymore. The very week I decided that, of course, they wanted me to come speak on this topic, and I decided I'd continue another week since it was rather lame to agree to speak on something I was no longer doing. So I went in and basically about halfway through this presentation reported them that I decided against continuing, and their reaction was one of outrage, that they were furious with me that I would abandon a constituency who had come to rely in some capacity, in some way, on me. And just that perspective of theirs really compelled me on to stay with something that only I had only instinct that it was a good thing. But that instinct, I will tell you, is something that needs to be nourished in each of you and nourished in other young people. I think physicians can do a great deal to empower young people and, again, to encourage this sense of instinct in what's right and what's wrong, what's good and what's bad. One more story about this is to illustrate about good and bad and how you know the difference. My partner, again, not to keep harping on this fellow, but thank you for not inviting him, by the way. He had a story about his mother. He was having a discussion with her one day about comedy. He said, "Hey, Mom, they just finished dinner." He said, "Mom, turn on the TV. I want to watch The Simpsons. That is the best comedy on television." To which his mom responded, "You got to be kidding. That thing sucks. I like Murphy Brown. My friends, we like Murphy Brown. That is our idea of good comedy." To which Adam responded, "Look, Mom, I write comedy. I know the difference between good and bad comedy. This is great comedy." She persevered. She persisted. This is not good comedy. And by the way, how dare you tell me what is good and what is not good comedy? I don't like it. My friends don't like it. So Adam said, "Fine. You don't like it. Great. Now, take this into consideration. Let's consider two paintings. Over here you have dogs playing poker on felt. Dogs playing poker. Over here, you have Monet water lilies. You may like the dogs playing poker painted on felt, but that doesn't make it a better painting than the Monet. But it does make you an idiot. So know what's right. Help them nurture that instinct. Listen, don't judge. Don't be afraid to reach your patients on their turf. I will tell you, that is another thing I think we sometimes fall down on as we want to stay in our ivory towers, and I encourage you to climb into where the need is, whatever that means for you, and trust that instinct about what is good and right about it before you do so. And then finally, it's a new millennium, okay? This is a chance for great change. There should be tremendous inspiration in the young people coming into the system today. In the passing of the 18th and the 19th, albeit the 19th and 20th century, there was spectacular intellectual dynamism around those transitions. In fact, they developed names for them. They were called the Zeitgeist or the Fin de siècle in France. Show us the Zeitgeist. Be inspiring to other people. This is a new spirit of the age is upon us, and I think you are the generation that was going to really bring this to bear in a real and palpable way. Know why you're in this profession. Attach limbic resonance. Inspire. Make a difference. Do good. Focus on youth. And listen to them. Do not judge. And fear not going into their turf. And above all, as such, be continent.
Us cared for over 1,000 patients, took over 70 calls, 3/4 of which constituted 36-hour shifts each, completed approximately 500 history and physicals, took and passed 5 national shelf exams, 2 sets of oral exams, assisted in the delivery of an average of 15 babies, suctioned, cut, and retracted in an estimated 100 surgeries, performed close to 100 well child checks, and at least once thought to ourselves while driving to work at 3 a.m. for morning pre-rounds, why am I here again? All of this while attending over 90 lectures, preparing PD4 presentations, learning how to shock, 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 everybody shock, little shock, big shock, everybody shock, big shock, and studying for and passing step 2 of the National Medical Boards. Wow. Now that is incredible, and that is exhausting. And yet, as we gather here today to commemorate the tremendous accomplishment of the last 4 years, we each prepare to begin what may very well be the most physically and mentally challenging year of our lives to date, internship. A year of more sleepless nights, missed dinners with our families, and an annual income that cowers in the face of our student loans.
So then we have to ask ourselves why. Why? Why would 92 perfectly intelligent and talented individuals voluntarily subject themselves to another several years of such rigors, having just completed 4 years of the same? Surely there must be some higher meaning, some greater cause that compels us to propel forward into residency with the same enthusiasm in which we entered medical school. Understanding what motivates our path requires recognition of our profession as a privilege. Every day, individuals trust their physicians with decisions regarding their lives. This trust is the foundation of one of the most sacred bonds known to man, the bond between a physician and a patient. It is this trust that grants physicians the privilege of empowering individuals with the knowledge necessary to make informed decisions regarding their health care. It is this trust that grants physicians the privilege of lending a compassionate ear to a patient who is frustrated with his illness, and offer words of reassurance to a father who is concerned about his child's medical ailment. And indeed, it is this trust that grants physicians the privilege of providing care for the physical, mental, and even spiritual health of the patient.
In honoring this privilege, we are constantly rewarded by our patients, be it in the form of a gentle look of gratitude in the patient's eyes as she mouths a quiet thank you after we have finished replacing the dressings of her post-surgical abdominal wound, or watching a child smile playfully again as he recovers from an episode of croup, holding a patient's hand during a lumbar puncture procedure, congratulating a patient on celebrating 2 years of being tobacco-free, or excitedly informing a couple that they are going to be parents for the first time. With such rewards, it is no wonder that we proudly wear our long white coats as a symbol of the intense training we have completed to earn the privilege of being a physician.
And so, in conclusion, as we receive our medical degrees here today, we reaffirm our dedication and commitment to our patients and stand tall with our gratitude for the trust you place in us each and every day. To paraphrase from Anna Quindlen, each time we look at our diplomas, we will remember that we are still students and you are our teachers. We thank the faculty of UC Irvine College of Medicine for helping us foster the skills and knowledge necessary to care for our fellow human beings. We thank our family and friends who have supported us through these 4 wonderful and many times trying years. We thank our classmates for being a constant source of encouragement and always lending a helping hand to each other when we needed it the most. And most of all, we thank our patients who have taught us about courage, endurance, hope, and the power of medicine. Thank you.
Thank you, Azin and Prithpal. Now I'd like to call, once again, Dr. Vaziri to administer the oath for the doctors of medicine. Dr. Vaziri?
I'm pleased to note that the oath I'm about to administer was written by the UCI class of 1977, and this oath has since been adopted by many institutions nationwide. With that, would the members of the graduating class please stand? I solemnly promise, as a physician, to practice my profession to the best of my ability. I will use my knowledge and skills to aid in prevention, diagnosis, and treatment of medical diseases. I will try to help my patients to understand disease, treatment, and prognosis. I will encourage my patients to participate in decisions relating to their lives. I will endeavor to alleviate their fears and recognize that occasionally the most meaningful treatment may be to listen with kindness and understanding. I will treat my patients with dignity and will give the respect and privacy which I would hope to receive if I were ill. I will keep their trust and preserve confidentiality. I will understand that a patient's sense of self-esteem is essential to good health. I value life as I strive to understand the process of dying. I will respect the wisdom of my teachers and will share my knowledge with others. I will strive to further my education and develop habits that promote further intellectual growth. I will be proud to practice medicine to the best of my ability and humble enough to call for assistance when necessary. I will encourage and cooperate with all others involved in the care of my patients so that others may perform their duties effectively and with consideration. I will live and practice medicine for people